Hi, I'm Dr. Kelly Stanfield with Stanfield Chiropractic. In this segment, I want to describe a common but often misunderstood condition, carpal tunnel syndrome. What is carpal tunnel syndrome, and how do you know if you have it? The simplest explanation is carpal tunnel syndrome is a nerve problem in the wrist and hand. More specifically, it is pressure on the median nerve as it passes through the wrist. The term carpal tunnel comes from the anatomy of the wrist. There are 8 small bones that form an arch shape in the wrist. The open or palm side of the arch is then covered with a strong connective tissue called the flexor retinaculum, thus forming the carpal tunnel. The tendons of the forearm and the median nerve passes through this tunnel en route to the hand. When there is irritation or injury to the wrist, the carpal tunnel can be squeezed ever so slightly by swelling, inflammation, or fluid buildup. The strong, durable tendons are unaffected by this change. However, the median nerve, like all nerves, is very sensitive. When pressure is applied because of inflammation in the tunnel, symptoms will manifest themselves in the first, second, third, and half of the fourth finger. These symptoms include paresthesia, or pins and needles, pain, and weakness. The symptoms are temporary at first, but become more difficult and more permanent as time passes. Most of you probably know someone who's had carpal tunnel surgery. The surgeon cuts the flexor retinaculum on the palm side of the wrist to allow more room and reduce pressure on the median nerve. The surgery is usually successful, but involves a period of disability and all the standard surgical risks. We as chiropractors focus on improving the function of the joints and reducing the inflammation naturally through conservative, non-surgical methods. Carpal tunnel syndrome usually responds well to chiropractic care and should always be tried first before surgery.